Alicia, do you want to start and kick us off, and then I'll jump in? You have to unmute yourself.
Yeah. Good morning, ladies and gentlemen. Thank you so much for the invitation to join our Caldwell Women's Forum today. Sandy reached out to us before Christmas and said, could you be available to talk about health and wellness and the future of this year with Caldwell UNC Healthcare? And we said, absolutely. So it's a very big day today, and Laura's going to share some more details about what's happening on campus today. But just to start off, one of our thoughts from Jonas Hill Hospital and Clinic. This was one of our posts on our Facebook, and it's a quote that captures where we're hoping 2021 will take us, that hope smiles from the threshold of the year to come, whispering it will be happier. And so we'd like to share you some happy news today and where we're headed. And Laura's going to start with some updates on COVID and our response and where we're at. And we hope to do about a 25-minute presentation and leave opportunity at the end for questions. So Laura, if you'd like to go ahead and take it from there, that'd be wonderful.
I'll do that, Alicia, and I assume you'll be advancing the slides?
Yes, ma'am.
Okay. If you want to go ahead and advance through the next slide. Give a moment for our technology to catch up with us. While Alicia does that, I don't mind getting started and chatting. Thank you all for the invitation to come and speak with you today. We are going to just start out our conversation with the top of mind topic, which I know we're all very fatigued from discussing, but we're just going to talk a little bit about the COVID-19 and our extraordinary year and where we are today and what we're doing for the future. As many of you are probably aware, we're really experiencing a surge nationally and statewide and locally. And a big part of our work right now is assuring that every citizen in the 4-county region here has access to compassionate and expert care. Yes, Alicia?
Faith, it's not advancing. I'm advancing it. I don't.
Hey, Alicia, do you want to stop sharing the screen and see that if it can catch up with us? That might work. All right, now try sharing again. If not, then you can send it over to me and we can make it happen. There we go. I can see it.
There you go. I think you're advancing it now. There you go. Thank you, Alicia. Excellent. Okay, so anyway, we're preparing for the future and trying to get ourselves on the other side of this pandemic and the way all of our lives have been so deeply affected from it. One of the really exciting and hopeful aspects of our work right now is the availability of vaccine and the distribution of vaccinations within our community. We are Caldwell UNC Healthcare. It has applied for and received designation as what we call an open vaccination site, which means we have the privilege of not only providing vaccination to our own employees, but also to the community at large. As many of you are probably aware, the process of administration of vaccine is highly regulated from the federal government in an attempt to assure that the prioritization of distribution of vaccine is the most beneficial to our communities. We started 3 weeks ago with the first vaccination of healthcare workers, which was a wonderful, wonderful day. And I am very proud to say that 80% of eligible healthcare workers at Caldwell UNC Healthcare have received their first vaccine. That is a very high percentage and a strong show of support to the community that our healthcare workers appreciate the value of the vaccine, understand the effectiveness of the vaccine, and are confident in the safety of the vaccine. And I think they set a great example for the community at large. And our hope and wish is that we are able to, within 6 months, provide a vaccine to every member of our community who is interested in receiving a vaccine. 6 months, quite honestly, is aggressive target because this is a 2 vaccination process, and it takes a lot of energy and effort and time to get everyone through. We started yesterday with our 1B, Group 1, which is the next phase of inoculation, and that is any citizens over the age of 75. Yesterday morning at 8:30, we had our first over 75 citizen, and you'll be interested to know that was David Horn and Mary Ruth Horn, who were standing at the door ready to go. Obviously people fawned to the chamber, and really happy to be able to provide that. We have set up in the downstairs area of Robbins Medical Park a vaccine clinic, and we have 8 stations starting on Monday. We'll have the capacity to provide vaccinations to 500 people per day, beginning on Monday, if you can imagine that. And it's quite an aggressive target that I've set for my team, but they have really rallied to the occasion. And we have received significant support from a variety of settings in order to accomplish this work and have the personnel to do it. We are rapidly responding. We have a phone line, a central phone line where everyone is being funneled who is interested in a vaccine, who meets the criteria, and as fast as we can, we're scheduling them for vaccination. In our physician network, we have 10,000 people who are over the age of 75. So we felt we had to have this pace. So that's 20,000 vaccinations if they all did it, got the vaccine. Of course, we're working in partnership with the health department for congregate living and other facilities, but you can kind of see, Sandy, you're making me laugh at the expression, you know, the scale of what we're trying to accomplish here. I mean, vaccinating 50 people a day, we'd be here for a long, long time. It's a big crowd. And the group 2 and group 3 are very large crowds because the next 2 groups really are all essential workers. So that's truck drivers and manufacturing employees and teachers and everybody. So there's a huge group that comes after, but we really want to get to all these groups. So we're being very aggressive and working to provide this clinic. To date, we have had no significant reactions on anybody who's received the vaccine. And we feel really confident in our ability to have folks come and become vaccinated. So that is the great hope. That is the great joy. And I'm so proud to be part of the UNC healthcare system because our healthcare system was a part of the clinical trials, and our physicians in Chapel Hill worked to create this vaccine. And they have shared with us all of the evidence from a personal perspective and understand that it is an effective and safe vaccination. We are very interested in impacting all communities in Caldwell County for vaccination. And there are certain communities who are sometimes seek less access or have less access to healthcare services, but we want to reach out and make sure that all communities in our county know that we have this service and they are eligible if they're over 75 and meet the criteria. So help us in getting that word out. The phone number, they can call any of the practices or the operator, they'll get directed to the phone number, and we can probably provide that later if it would be helpful. If you want to go to the next slide. So I know most of you have heard that we have built, I'm going to say it this way, in 7 days, we built a 30-bed hospital, which is an unbelievable feat. I find no joy in needing it, but I do find joy in the creation of this facility. It was a monumental effort. in a partnership with Samaritan's Purse. So in that partnership, it's a partnership of people from around the country and around the world who have been generous with their gifts and donation. It's a partnership with doctors and nurses who are generous with their talents, who have come here to serve. It's a partnership with 5 hospitals in the region, as we will all be bringing patients to this facility. And it's a partnership with UNC Healthcare System, as they have brought their skills and talents to getting this off the ground. We have a definite need today. I'm talking with CEOs in the 5 area hospitals every day, and there are less than 10 beds available in the entire 4-county region for admissions. So you can imagine how tight things are. And there are many patients who are sitting in emergency rooms waiting the opportunity to have a bed to go into. So the timing is perfect in terms of bringing this resource. And we will have an opening ceremony today at around 10:30, and we will probably admit our first patient at 11 o'clock. It's very interesting. This site and these tents are really something to behold. I think everyone would feel a sense of apprehension to get healthcare in a tent in our modern era. But I have spent time in these tents. We have furnished these tents. They are hospital beds, hospital IVs, hospital monitoring, oxygen. They are a ward, male wards and female wards, but they are staffed with all the technology you would need and the most compassionate and expert staff. The staff in these tents are the same people who went to New York City and set up the field hospital in Central Park. They're the same people who went to Italy and set up the field hospital during the peak of the initial outbreak of COVID. They're extremely experienced and competent. And they actually shared with me that in those settings, initially patients were apprehensive, but soon they began requesting the opportunity to go to the field hospital. As you may be aware, COVID care can be somewhat isolating, and it's something we work really hard to accommodate, but families and visitors can't be present, and it can be very lonely in your patient room. In this ward, this is what we call a hot ward. Everyone in the ward will be COVID positive. Everyone will, there'll be a limited number of people who enter the tents, and they said within that tent there's a certain socialization that occurs, a club almost of warriors coming together to heal and get better, and there's a connection, and patients actually appreciate the ward environment over the isolation of a room because they can see and talk to and have companionship. And the nurses never leave the room, so there's never a time where they are in a space without someone in that space with them. So it's a blessing, it's a miracle, and it's a gift, and we're very grateful to provide this service to the folks who need it in this region. And in the end, I can answer any questions you might have about this.
Hey, Laura, we did have a question come through from April Austin. April says, are the 75 plus patients being contacted by doctor's offices to make them aware of how to get the vaccine?
Yeah, that's a great question. We are kind of approaching it in a twofold way. We're responding to phone queries, people who call in and request vaccine, and we're also focusing on calling patients. We have sent out some people who have the MyChart application on their phone, informing them that they are eligible. The challenge is we're really going to have to schedule only 2 weeks in order to make sure that we have a supply of vaccine to provide, and that's a week-to-week allocation. So we're kind of scheduling 2 weeks out, and so some folks may have to wait a little bit for us to respond and actually make their scheduled appointment. But of course, we're working as diligently and aggressively can, and we are hopeful that we will have a consistent flow of vaccine. So call in if you're interested, and if you call your doctor's office, they will refer you to this central line for registering.
Very good. Thank you. We also had another question come in from Kim Dalston. She says that she heard this morning on the radio that the 30 beds are already full. Is this true?
No, there's no patients in the tents yet. We have identified 20 potential eligible patients, and as of 11 o'clock today, we're going to start screening those patients and assuring that they continue to be the right level of care, and we will bring them over. It'll take us a little time. I think we probably won't go over 15 patients today, and it may be even a challenge to transport 15 patients and get them admitted. And those will come from Caldwell. Tomorrow, we'll start to take patients from the other 4 hospitals. So I fully expect we will fill the hospital by Monday. You're on mute, dear.
Thank you. That is all the questions that we have at the moment on our chat.
Thank you, Faith. So we wanted to share with the forum some of the highlights, some of our brilliant work over the past year and what we look forward to this coming year. So the first thing we wanted to share is our hopeful news regarding our Jonas Hill Hospital and Clinic. A highlight of last year was that we proceeded and completed our construction of our Jonas Hill Hospital and Clinic, which is a 23,000 square foot facility on campus. And it is an opportunity for us to provide inpatient hospitalization for adults with mental illness, as well as we will be opening our outpatient psychiatric clinic, Jonas Hill Clinic, this coming summer. We have an amazing website. We're asking you to go ahead to that website at some point. It's at jonashill.org. It also has a Facebook link and an Instagram link, and allow you to learn more about the facility. There's an actual virtual tour on that website. And we, at this moment in time, are able to provide care to men and women in our community who have an acute mental illness on our 27-bed adult inpatient unit. It's very unique in the way we designed it. We have very much been able to create a venue that has an open air concept, windows, natural lighting. It has a beautiful a beautiful healing commons where patients can go every day to get opportunity to be outside. We do our recreational therapy at that venue. And we were able to open in July of this past summer. And so we are almost at our 6-month point of admitting patients. We made the decision to move forward with the opening amidst a pandemic and our COVID. All of our patients who are screened prior to admission to Jonas Hill inpatient unit, they all are COVID negative. And we have seen how we've been able to still have those patients have visitation from their family members during their hospital stay. I'd like to introduce you just very quickly to our team, our dedicated exceptional patient care providers. This is Dr. Matthew Hartzell. He's our medical director, along with Marquita Bogus. She is our psych nurse practitioner who is our lead. We also have 2 other physicians. We have Dr. Amy Singleton, who's pictured in the slide, as well as Dr. Holly McNew. They are our 2 psychiatrists who are on staff, and they do a 7 off, 7 on rotation. So either Dr. Singleton or Dr. McNew will be seeing our patients. And then Trish Buma is one of our nurse practitioners who is focused in psychiatry, as well as we have Chad Forbes, who is our additional team member. As I mentioned, we opened up our inpatient unit this past July. And at this point in time, our census has been running at about 15 patients every day. We are ramping that up as we move into 2021. And We are excited for the opportunity for our outpatient clinic. Will be opening this August. In our clinic side of Jonas Hill, we'll have a psychiatrist and a psych nurse practitioner and a licensed clinical social worker. We will do psychological evaluations. We will do medication management. We will be doing post-discharge care of patients. We will also have the opportunity to provide support groups and psychoeducational, telepsychoeducational support. With COVID, we are anticipating that much of our outpatient psychiatric care will have to be virtual. So we are equipping the clinic so that we'll be able to do that very readily. Laura, was there anything you'd like to add regarding Jonas Hill Hospital and Clinic?
Let's see here, am I muted? Okay. No, I'm really very pleased with the way this facility has progressed. We've really hired some wonderful, kind, compassionate people who really love this work, and I think are going to really benefit everyone who walks through the doors. So it's been 6 months, almost to the day, since we opened, and it is a place of hope and compassionate treatment, and it's really a blessing also to this community.
Thank you, Laura. Another new blessing is to introduce you to Dr. Amy Abu Zed. Dr. Abu Zed joined our Laurel Park Women's Health team actually a full year ago. She came on right before COVID hit us. So she has not had the opportunity to go into the community and meet many of you, but she's brilliant. She joined our Laurel Park Women's Health team. Her practice is in the clinic specifically. She is a brilliant gynecologic surgeon as well as an obstetrician. So she joined our team. This is a picture of our current team at Laurel Park Women's Health. We have Dr. Abu Zed and Dr. Robert Dacus, along with Laura Clark, who's one of our certified nurse midwives, and Sally Susi, who is our second certified nurse midwife. And I've just listed some of the specific services, excellent care that from a gynecologic perspective, we're able to offer at Laurel Park Women's Health. In addition to the clinic practice of gynecology, we also at Laurel Park Women's Health are very focused on obstetrics. From preconception counseling and infertility evaluation and treatment and genetic screenings, all the way through prenatal care. We work very, very closely with our Obgyn Hospitalist program, and we're going to talk a little bit more about that. But we are able to provide exceptional one-on-one, focused, detailed care for women who are needing obstetrical care. In addition to that, we also specifically are offering women's health services. So providing care to women across the lifespan. With Well Women exams, we have a weight loss program. In both of our offices, both at Laurel Park Women's Health in Lenoir and Laurel Park Women's Health in Granite Falls, we offer mammography, nutritional counseling, behavioral health services, and genetic testing. We started last year at this time our Obgyn Hospitalist program. And this is a new concept to our community, but is not a new concept across the nation. The focus is that we have dedicated team of obstetrician and gynecologists who practice in our hospital. They're an extension of Laurel Park Women's Health. They don't have a clinical practice, but they are here at our Feeling Birthplace in our hospital 24/7, 7 days a week, 365 days a year, to provide that exceptional obstetrical and gynecologic care in our hospital. So Dr. Stephanie Brogdon, along with Dr. Janet Matthews, are our OBGYN hospitalist team. And they specifically are here and available to deliver all of our babies. They do all of our C-sections, any GYN emergency that presents, and any inpatient consult that is at the hospital. They lead that clinical practice. So they work as part of our team on the Family Birthplace, as well as our team at Laurel Park Women's Health. They help us manage all of our high-risk pregnancies, and they also will cover the emergency department if needed. This is a picture of our family birthplace in one of our labor and delivery suites. So Dr. Brogdon and Dr. Janet Matthews work with our family birthplace nursing team to provide exceptional care to our moms and families and our newborns. Very much focused on our rooming in concept, which is where the baby stays with the mom during their stay, as well as we've done some specific work to increase our opportunity for skin to skin, that golden hour from the time that the baby is born, immediate skin to skin contact, uninterrupted and immediate with mom, whether it is a vaginal delivery or a cesarean section. We very much are focusing on that skin to skin and that experience. So the overall experience for our moms and babies, we've done much focused work, and Dr. Brogdon and Dr. Matthews are leading that effort. This is a picture of our 3D mammography, our tomosynthesis unit that's available for breast health and breast imaging, screening mammography at our Granite Falls location of Laurel Park Women's Health. This office is actually on 321 right next to Captain's Galley, but this is a piece of equipment that we added 2 years ago. It's our 3D tomosynthesis unit. And you can have a personal spa-like experience at our Granite Falls location. We also provide mammography at our Lenore location. But this coming year, we'll be looking at expanding our breast health program and creating more opportunities for 3D imaging within those two practices. Aesthetics, we do have an aesthetics program, an aesthetics and wellness program at Laurel Park also. Jennifer Boaz is our fabulous esthetician, along with Laura Clark. The two of them have paired up, and they're able to provide outstanding opportunities for aesthetics, everywhere from a free complimentary skin consultation. Laura Clark is able to administer Botox, chemical peels, microneedling, hair removal, acne treatment, teeth whitening, all kinds of amazing things Jennifer could do for you. The intense pulse light and LED light therapy is something that no one else in the area is doing. And we're thrilled with Jennifer being available both at Granite Falls and Lenore location. And you can call either of those offices to schedule opportunities for aesthetics. Very quickly, I wanted to talk to you about some of our children's service line updates. We know that women make about 80% of all healthcare decisions for their families. And so we know many of you are mothers, grandmothers, aunts, and very much want you to meet our pediatric team. Here in Mulberry Pediatrics is downtown Lenore. Our providers there are Dr. Kunkel and Dr. Darnell and Dr. Carver, along with Dr. Tricia Masters. They provide all of our pediatric care for our Lenore-based Mulberry Pediatrics. Our Falls-based pediatric, the Falls Peds, we have Dr. Chris Smith-Math, Dr. Leslie McGinnis, Dr. David Masters, and then we have our two nurse practitioners, Liz Fowler and Elizabeth Caldwell. At the same location, we also have the Falls Peds Plus Urgent Care, which is on the upper level of that location. And that team there, we have Jessica Oxide and Holly Duncan, along with Dr. Terry Dodds, who is semi-retired. Our Falls Pediatric Plus Urgent Care at this moment in time, when COVID began, we consolidated all of our pediatric care to 2 locations, and we temporarily diverted all of our urgent care patients to Falls Peds practice. We just recently, this past Monday, reopened our Falls Pediatric Plus Urgent Care, and we are serving all of our sick children in that location. It is a walk-in, not needing an appointment opportunity, where our children can be seen by a pediatric provider, as well as we can do COVID testing at that location. So we're trying to divert children that need immediate care, need to be seen by a provider, to our urgent care location on 321. Our 2 respiratory diagnostic centers are still wonderfully capable and able to see children at those drive-in locations. But if there's an urgent need and a sick child and they need to be seen immediately, Falls Peace Urgent Care is now operational and able to do that for us. We're just going to share some brilliant updates regarding our surgical program and our heart and vascular programs.
Yes, look at those smiling faces. I mean, I think probably most everybody recognizes the smiling face in the middle, Ross Jenkins. Dr. Jenkins is a podiatrist who is really a foot and ankle surgeon, a phenomenal member of our community for a long period of time, have very strong practice. This past year, in order to meet the needs of our community, we have expanded and rebranded his practice to be part what we're calling UNC Ortho. And Dr. Duggan is also a foot and ankle surgeon. He actually helped train Ross Jenkins when Ross was in school many years ago. He relocated here and he's building a house up in Collettsville and has been a great new addition to the team. And then most recently, we added Dr. Justin Walker. Dr. Walker is an orthopedic surgeon. He does call and all kinds of surgery. His subspecialty is hands, wrist, elbow, shoulder. So he's an upper extremity expert, and he has hit the ground running. He came last August. He's been extremely well received. He's a very kind and nice person. He and his wife and his young child and their dogs are here in our community getting settled and really well received. So this is a growing and valued part of our community orthopedic program to complement the wonderful care that the physicians of Emerge Ortho have offered for a long time. So there's some great new faces and a familiar old face serving the community. Our general surgery program has really grown. We have added a number of new physicians and have a very strong general surgery group. Many of you know Dr. Petsy. He has worked here for a long time. His wife and his family, very much a part of our community. And he was joined several years ago by Dr. Young, who is on the left side of that photograph. Dr. Young and his wife, and I think he just had a second child. I think they have two young children. They really enjoyed living and working in our community. And the gentleman just to the left of Dr. Young, Dr. Sharpton, trained with Dr. Young, and they did residency together, and Dr. Young recruited Dr. Sharpton to move to our community, and he joined us recently, just this last fall, and he has hit the ground running, a wonderful man. Dr. Goncalves also joined us about a year and a half ago. So you can see we really expanded our capacity in general surgery. They do everything from, gallbladder surgery, hernia surgery, colonoscopies, trauma, all kinds of, appendixes. They're very in demand, and they're an excellent part of our team. I just love looking at that picture because they look pretty tough there, don't they? They're really softies. All of them are real softies. And Jeff Williams is working alongside them as a PA, physician assistant. On the right-hand side, you can see our ear, nose, and throat and audiology program. Dr. Cleany joined us a year or two ago and has really met a need in our community that we had not filled since Dr. Darcy, I think I saw Dottie on the line, Dr. Darcy filled for our community many years ago. And Dr. Cleany is an ex-military man from the Navy, retired from the Navy. He's super capable. Really fun and interesting man, and very good with children, providing services, ear, nose, and throat. You may recognize Jonathan Smith there, who is his PA. Jonathan grew up in Lenore. His father is Dr. David Smith. He went to PA school, and he has been working with us and with Dr. Cleany. And of course, our audiology services are provided by Sam there, our audiologist. So great program we have for ear, nose, and throat. Urology. Urology has been a really big need in our community for a long time. And we were successful in recruiting Dr. Ralph Duckett a little over maybe 2 years ago. Dr. Duckett came to us from High Point, North Carolina. He was where he worked most of his career. And he brought with him a colleague from Novant in Winston-Salem, Dr. David Cook. They're a great duo. The thing I would want you to know about Dr. Duckett is his expertise and most of his experience is actually in the care of women gynecological problems. He is an expert in reconstruction and pelvic reconstruction and managing and helping women with urologic needs. And he is so approachable. He is so kind. I've only heard good things about how he's been able to work with women to address their urologic needs. So that's a specialty that really doesn't exist in our region, but that we now have with Dr. Ralph Duckett. Heart and vascular. This is Dr. Andy Chu. I would like to introduce you to, and Tara England. Dr. Chu is an interventional cardiologist. He does cardiac caths and stent placement in our cath lab. Dr. Chu joined us also from High Point. UNC had, at one time, the hospital in High Point was part of the UNC Health system, and we became connected with some of these physicians during that time. And as things changed and really the health system there is a little bit disrupted, changing ownership, we picked up some great doctors, and Dr. Chu is one of those. Dr. Chu has 5 children. They are absolutely beautiful, and he and his wife are looking to build a home here and raise their 5 children on a beautiful piece of land that they can build a farm. So if any of you know of such property, they are interested in building a home and raising their children in nature and outdoors. And he's an outstanding physician, very experienced. He hit the ground running, and he is making a great contribution already to our cardiology program. Tara England is a nurse practitioner, and Tara has worked here in Caldwell County for many years. She was a nurse who went back to school and got additional training to be a nurse practitioner. And she worked in our ICU for many years. And now she's joining Dr. Chu to help him with the large caseload of patients. Heart disease is the most common health issue in our community. And so we have a lot of people with need, and we're continuing to build this program and intend to add additional cardiologists and vascular surgeons to UNC Heart and Vascular over the next year. So as you can see, it's a very dynamic time at Caldwell UNC Healthcare. You know, it is our mission to serve this community, all of you, all of your families, everyone that you love, with access to compassionate and high quality medical care. It's what we wake up and come to work to achieve every single day. And I hope that we are serving you well in that way. Oh, how cute.
Thank you.
Thank you, Laura. I did have a question come through from Sandra Williams, going back to the Samaritan's Purse field hospital. You had mentioned that there were 4 other hospitals that were going to start allowing patients to funnel in through. She was just wondering what those other 4 hospitals were or where.
Oh, sure. Sure. Catawba Valley Medical Center, Fry Regional Medical Center, Blue Ridge Healthcare in Morganton, and Appalachian Regional Health System in Watauga. And you can see we're kind of centrally located to all those hospitals. So it's about a 30 to 40 minute drive to each of those locations. So we were kind of the most central location for this hospital. And one of the reasons we were chosen to be a part of it. I would also let you know that the scale of that blessing is that every state has called Samaritan's Purse and requested a field hospital in the past 4 weeks. They have governors, senators, and hospitals calling them for help. And they are going to be setting up a field hospital in Los Angeles. They've started this week to help that Southern California area. But they had a very strong belief that they needed to help their own community, their neighbors, their friends, and the people who have supported them as an agency for a long time. So we're very fortunate to be in the backyard of Samaritan's Purse.
Faith, I would like to share the vaccine number in case anyone wanted that phone number.
Okay.
So the vaccine management number would be 757-6487. 757-6487.
And that's the vaccine.
That's the vaccine call-in number.
Call it. Perfect. We had a question come in from Ms. Conla Rainey. She says, what if you have allergies to meds? Can you still take the COVID vaccine?
Yes. Depending upon, that's something you would really need to confer with the with medical professionals about, because it just depends on what you're allergic to and what the nature of your reactions have been as to whether that's something you should consider when you take this vaccine. So definitely a dialogue if you have significant allergies and have a history of significant reactions, that you should take that up with your provider and they can help you weigh the pros and cons.
Very good. Thank you. Does anyone else have any question? I see Sandy has a note for us.
So cute. Sandy, you're so cute. I think as we, this community has an amazing ability to come together and to work together and to be supportive. And I will tell you, the Samaritan's Purse crew, they're just blown away. They just can't believe. They said one thing for sure, we're going to leave here fatter than when we came because so much food has arrived on the table. I said, we don't know what to do, but we know how to cook. So they're really pleasing. And I would say we need your prayers. Our staff need your prayers. They have, and I would pray for their strengthening and their nourishment. The work is very strenuous. It's a lot of people going way above and beyond. And it's very fatiguing work, physically and emotionally. And, they need renewal. So anything you can do to pray for and for their renewal and strengthening. I would also say, if you know a healthcare professional, there's someone who that is a friend or a sister or a relative or, that works in this building or in this organization, because not just this building. I didn't mention the Respiratory Diagnostic Center, but there's some incredible people working in unusual conditions in long days to serve a lot of people. I just will add RDC. Since March, yes. At the RDC, we are presently testing 7 people every 15 minutes. If you can imagine that. So they're working really hard, and it's a little cold out there today. So in all kinds of conditions. But I would just, going back to your question, if you know anybody, I think the smallest act of kindness from people acknowledging your fatigue, because they go home after this and they have to take care of their families. They have to cook dinner, they have to do the laundry, they have to clean the house, all the things that we do.
And some of them have to go home and teach their children.
And teach their
who are doing virtual learning.
That's right. It's just incredible pressure they're under on all sides. So I think any action, the smallest, providing a meal for a friend at home or helping their family, babysitting, anything that you can do to help the people that who are working here would be greatly appreciated, so that they can rest and they can recover. So
Yes.
Those are the things that come to mind, Sandy.
Well, thank you so much, Laura and Alicia, for being with us today. We know that you're very busy ladies, especially now with everything going on, and we really appreciate you coming out, taking the time and speaking with our group and our ladies of Caldwell County. We can't thank you enough.
Thank you.
Thank you, Faith. It was an honor.